In this video, we're addressing the mobility of the thoracic cage, which is that part of the spine where ribs are attaching to the spine. And frequently, a person's pain in the spine is commonly coming from the cervical area and the lumbar area. But we see dramatic differences if we can do something about their posture. If Kate would assume a slouch posture, we can see that this thoracic cage is excessively rounded. And we can see that her bone in her cheek, the maxillary bone, is out in front of her rib cage in the front. If she assumed a more erect posture, I would ask her to lift this part where my hand is touching. Do not do anything special with the shoulder blades, like pinching them back like many are told to do, but just simply take this part of your spine and elevate it, or I touch the sternum and I say, lift into my fingers. And then that activates muscles in the postural area covering the thoracic cage that bring about this posture that's erect. The other component that we might look at for the neck is that we ask the back of the skull to be the tallest part of their body. And when they do that, frequently they're a little off on what they perceive good posture, and they lift their head up. And the forehead is attempting to be the tallest aspect of their posture. And we quickly correct and say it's the back of the skull that needs to stretch up. So these two components of making the thoracic cage erect and the back of the skull be the tallest part of the body can help facilitate a posture that is more mid-range for both the cervical area and the lumbar area. Frequently, with a person who has either low tone in the spinal muscles throughout the thoracic cage, or they have stiffness, or they have a combination of both, we have to address the stiffness and the strength. So first, we're going to address the stiffness. So we're assuming that Kate is a very slouched posture, and she's 60 years old, and this part is so slouched that when she walks, she could be a fall risk because of that forward head takes her off balance. So we start very, very carefully to move this area. So we're going to stab her on the ball first. As I ask her to relax here, we're just beginning the beginning phases of motion in this stiff area, so that if she has both palms on the floor and her head is resting on the ball, and then she allows her knees to split apart and rocks back this way. And now one hand will slide on the floor as far as it can go. This shoulder blade is stretching forward and up towards your ear so much that it actually makes the spine curve where my fingers are. So the spine is curved in a C like this to the right. And then that hand comes back and the opposite hand slides out. And now the spine moves in a way that produces a C to the left, or we call it a convexity, where the curve is to the left. In this way, it's curving to the left. And then she would produce this exercise: right side, stretch, left side, stretch. Right side, stretch, left side, stretch. And in so doing, with the shoulder blades and their attachment on the right side, and the right hand slides forward, this part of the thoracic cage curves to the right. Go ahead and do that. And then I can see that. And then if the camera is elevated, it can come up and see this also. So the hand comes back. And then the left hand would go out, and these shoulder blade muscles that attach to the spine would actually curve the spine to the left in this manner. I'm tracing Kate's spine with my 2 fingers. I'm on either side of the spinous process when I'm doing this. When she moves her right palm and slides it as far as she possibly can on the floor, not losing contact, the scapula muscles or shoulder blade muscles that attach to the spine curve the spine, and the camera can see that it's curved out to the right in this case. Bring the hand back, and then the other hand moves out, and it reaches so far that there is this slight curve to the left. And there is the curve to the left. It comes back, and then right hand slides out, and there's the curve to the right. So there's a right curve. On the model, it would be curved to the right when the right hand goes out, and then left hand goes out, curved to the left. And what that does is it produces a motion in all of these joints here and tries to attempt to improve their flexibility by getting movement left and right with these different arm motions in this very introductory phase. In this position, this would be the next level after the person begins with a very stiff thoracic cage whereby they're lying chest down on the ball. Now we're lying chest up on the ball, and you can see that her thoracic cage is now curved over that gym ball because she has dropped her pelvis almost to the floor. Her feet are wide apart for good stability. And next, we're going to use those shoulder blade muscles that attach to the thoracic spine to move in opposite directions so that when she does, and they move, her sternum side bends to one side, and then she switches her arms position, and the sternum side bends to the opposite side when she maximally reaches. It has to be that much. Okay, and then slowly switch, and then the sternum maximally reaches, and we see this spine that is curved over the ball out of its rounded slouch position, but now curved over the ball, is also side bending so that those joints are getting a great deal more flexibility at a higher level than the first exercise. So as she moves, it has to be a maximal effort every repetition, and she only has to hold it for a count, and then she switches. But we would do many of these, like 30 to 40, so that these joints could become warmer and flexible. In this case, once the arms are positioned, I don't want the listener to think that the arm is stretching to the floor. It's not. It rests comfortably overhead, and then the direction it stretches is the direction I'm pointing. The hand that's down by her knee stretches for her kneecap. And when she does that maximally, you can see the sternum move. Go ahead. And it's a maximal reach, and the sternum moves, creating this improved flexibility in the thoracic cage spinal joints.